Good morning, students. I hope you're keeping safe. Today, we're going to talk about Daru, Sutta, Baba. Okay, so quite popular, but dangerous if not done within limits. So directly coming to a very important concept, that is adolescence. Okay. This portion is a part of the chapter Human Diseases, and questions do come. And I thought of delivering this because it has a direct impact on you and people around you, okay, including your family. So to talk about the word adolescence itself, you are in this period, most of you, not all. Basically, this is a period that forms a bridge between your childhood and adulthood. Okay, there are changes in your attitude, in your thought process, there's psychological developments, there are mental changes. Your physical changes are also seen because of the hormonal changes. For example, appearance of mustache in the boys. A child becomes mature in terms of his or her attitude and beliefs. And this period basically decides how a person would be. So this is one of the most critical phases of anyone's life. The word adolescence itself is derived from the Latin word adolescere, which means to grow up. Okay. This slide, you can see a lot of words. Don't be confused. Very simple. Just listen to what I'm saying. What you need to remember here, a few keywords like 12 to 19 years of age considered to be the period of adolescence. WHO has tagged this period as the period of adolescence. It is a phase where psychological, social, this is very important, and physical transition from childhood to adulthood occurs. Okay, social, for example, some people, for example, these days happen to be constantly engaged in social media, Facebook, Instagram. You follow, you have the influencer concept and every stuff. And some people during this period tend to remain aloof. They love to stay alone in a room, shut down their doors. So there can a lot of changes happening. Okay. Why these changes occur? Okay, there are a lot of alterations or modulations or differences happen within your body. One of the prime reason is that you can see a phrase called synaptic pruning. I hope you remember the word synapse related to the interconnecting junctions between the nerves, okay, nerve cells. So as a person passes through this period, the number of nerve cells and the synapse, the interconnecting zones reduce, okay. So there is more connections established between the a more matured kind of interactions happen, okay. So there is some kind of neural structural changes. The brain undergoes some kind of changes. Okay. So the person develops his or her own thought process, and also the understanding about the various things and activities develops. Okay. But the issues associated with adolescence are multifold. There can be multiple issues. Okay. Many times what happens, a boy or a girl, but in the teenager, he or she happens to imagine that he or she is the leader. She is the queen, he is the king, and everyone should follow him or her. Okay, so he thinks that he has an imaginary audience and he has to impress everyone. That is what happening, right? You can see these days everyone poses with so beautiful clicks on Instagram, and you have so many likes going on around. Many want some kind of adventurous life during this phase. You go for high-speed biking, driving. You have the PUBG player. You want to be the king. You have all kinds of sports going on around. Many go for bodybuilding, gymming. They want to look good. They want to stay fit. Okay, but okay. Remember one thing, both the sexes, be it male or female, suffer from certain problems during this phase. Okay. Many of you might have experienced the cases of pimples, acne. Okay, what is acne? Basically, what happens during this period, the sex hormones are at their maximal activity, it seems, or they start to sprout out. Okay, so the skin pores, they get clogged due to the influx of sex hormones, particularly testosterone. Okay, so that leads to the problem of acne, acne. Some children, they become very conscious about their health. Okay, uh, some want to eat a lot of food during this period, and some they do not eat. They tend to have a zero size figure. Okay, particularly the ladies. Okay, uh, because what they see around, that impact a lot. Okay, also there could be periods problem in girls. Okay, sometimes what happens, monthly periods or the menstrual cycle may be disturbed. Okay, and there could be also some cases where students, they tend to uh, opt for social withdrawal. They want to live alone. Akela akela rehna chahta hai. Okay, at the same time, some people may show a very different kind of behavior, that is they will tend to get involved in various social activities, gregariousness. Okay, and one of the major issues that haunts this period is the tendency to get addicted to drugs, alcohol, tobacco chewing, smoking, and other stuff. Okay, this is quite common all over the planet. Okay, okay. So if the healthy adolescence is not ensured, then there might be some serious issues with uh, ensuring a healthy adulthood. Okay, so this period is very, very critical, and we should try that uh, we get involved in good activities. Many of you are at the ultimate ages of your adolescence, 17, 18, 19. Okay, so many might get addicted to pornography. Okay, blue flames, uh, love, emotional breakdown. These are very common during this period. Okay, but the focus right now, drug abuse, alcohol abuse, and use in adolescence period. Now, what could be the causes? Okay, there could be a lot of causes. Okay, for example, you have a friend or some senior or someone in your locality who drinks, who smokes, and out of curiosity, out of experimentation, you want to test it, you want to check it, and you get the first puff or first drink, and then you become gradually adapted to it, and you like it, and you take it as a habit. Okay, many people want to go out for adventure, excitement. Okay, I have personally seen many students who go from DIBRUGARH to other places, or many people who come to stay in DIBRUGARH. This Baba stuff, the weed stuff is very common. Okay, I have been staying in so many different countries. I was in Africa as an assistant professor in university. I just returned this year because of COVID situation. Nevertheless, I had seen a lot of people going all around, particularly the children of your age, okay, uh, looking for this kind of stuff, okay, shisha, okay, the hookah, everything, okay. Many people, people in a sense, the people of this age particularly, they want to escape facing problems. There could be different kinds of problems, family issues, overload of studies, academics. The parents might be asking the students to outperform your neighbor's students, neighbor's daughter or son. So that really creates an overload of pressure, mental pressure. You have to excel in exam. Then the whole case of alcohol use, abuse, drug abuse have been popularized in pop culture. Pop culture implying different videos, movies, newspapers, internet, etc., etc. And peer pressure is always there. So chalo chalo ek sutta marte kuch nahi hoga. Okay, and that becomes a habit. That is really bad. Okay, peers means friends. They happen to be one of the greatest influences in your life. You cannot avoid your friends, right? But friendship should also have a limit. Okay. But at the same time, I also want to stress one fact. Even though we are talking about alcohol use and abuse, many medicines do have alcohol. But remember, what I'm stressing at this moment is the concentration, the nature, and the make in which the alcohol is being used. It is for medicinal purpose, not something to get addicted to. Okay, this is very important. Talk about the terms addiction and dependence. The word addiction itself implies you are becoming physically, first important word, physically, physiologically and psychologically dependent on an addictive substance. Physically means your body wants that. Physiologically, your metabolic activities won't go if you do not get the substance. Okay, you feel as if it is happening. Psychologically, it implies that your mind wants that. Okay, and you become dependent on the addictive substance. Okay, so when you get psychologically attached to drugs and alcohol, you feel as if you are getting a sense of euphoria, a divine pleasure, a heavenly pleasure. Okay, but at the same time, many people also feel some kind of well-being, temporary feeling of well-being. Remember the word temporary, it is not permanent. Okay, another very important thing to note, when our body has lot of receptors. Okay, on every cell there are certain biomolecules like carbohydrates, proteins, etc., and these act as receptors. Okay. Our body also has certain receptors, and the drug molecules can bind to these receptors. Okay, there is a limit, but if you continuously keep on consuming these drugs, then what happens? The tolerance level of the receptors increase. So your body wants more and more drugs to be bound to the receptors. Okay, and your receptors can respond to higher doses only. Okay, so your body becomes addicted. Means, if I tell it in a different way, suppose you have taken a drug X and there is receptor Y. The drug X binds to the receptor Y in your body, and once it binds, there is some kind of signaling going on, and you feel good about it. You feel some kind of heavenly pleasure. But if you continuously use the drug repeatedly, then what happens? You need more amount of X to bind to Y in order to create the same feeling. Okay, so the interaction between the receptor and the drug has to be augmented or increased by supplying the body with more amount of the drug. Okay, because of that, your body becomes addicted. It becomes dependent. Okay. And how do the addictive substances affect the system? Basically, it alters the brain chemistry. Okay, there are a lot of biomolecules, lot of chemical agents in our brain system, and there's a particular chemical called dopamine. This is one of the key biomolecule through which the brain chemistry is altered or modulated or changed by the various addictive substances. Remember this. Another common question that is often asked in entrance, fill up the blank, they will give different words. Initial stage of drug addiction is called dash. Answer is habituation. So पहला जो stage होता है उसको habituation बोलते हैं. ठीक है, याद रखिएगा. Then the word dependence. So once you become gradually habituated, you become addicted and you become dependent. Means डिपेंडेंस क्या है? आप किसी के ऊपर कंप्लीटली आश्रित होना, टोटली डिपेंड हो जाना. ठीक है. Now what happens if you do not get the drug, if you are not supplied with the alcohol? Okay, what happens? Your body will show some kind of strange behavior. Okay, unpleasant withdrawal syndrome if regular dose of drugs or alcohol is not supplied or abruptly discontinued. Suddenly, अगर आप body को ये ड्रग या अल्कोहल सप्लाई नहीं करोगे तो आपका बॉडी कुछ अनप्लेजेंट विड्रॉल सिंड्रोम्स दिखाएंगे। सिंड्रोम मतलब कलेक्शन ऑफ सिम्टम्स। ओके, जैसे शेक करना, ओके, एंजाइटी होना, बहुत ज्यादा पसीना निकलना, ओके, नौशिया होना, ओके। और बिकॉज ऑफ दिस देयर कुड बी लॉट ऑफ सोशल एडजस्टमेंट प्रॉब्लम्स। सोशल एडजस्टमेंट प्रॉब्लम्स कैसे हो सकते हैं? जैसे आपको ड्रग नहीं मिल रहा है तो बहुत कारण के लिए नहीं मिल सकता, जैसे आपके पास पैसा नहीं है, सो एज अ रिजल्ट ऑफ विच यू माइट इवन स्टील, किसी को मार सकते हो, किल कर सकते हो पैसा पाने के लिए और वो ड्रग को हासिल करने के लिए, ठीक है। So this can be really catastrophic to your own life as well as the people around you. Okay. Now to talk about drugs, देखो medically drugs जो होते हैं वो हम लोग मेडिसिन को भी ड्रग वर्ड यूज करते हैं, ठीक है। WHO कहता है कि कोई भी सब्सटेंस जिसका यूज या इंटेंडेड टू यूज किस लिए होता है, ताकि आपका फिजियोलॉजिकल या पैथोलॉजिकल स्टेट को मॉडिफाई किया जा सके आपके बेनिफिट के लिए। ओके, मतलब कोई भी सब्सटेंस विच इज यूज्ड और इंटेंडेड टू बी यूज्ड, ठीक है, ये शब्दों को थोड़ा ध्यान रखिएगा। सब्सटेंस दैट इज यूज्ड और इंटेंडेड टू बी यूज्ड, इसके लिए मॉडिफाई और एक्सप्लोर फिजियोलॉजिकल और पैथोलॉजिकल। फिजियोलॉजिकल मतलब आपका मेटाबॉलिक कंडीशंस एंड ऑल दो स्टफ। पैथोलॉजिकल अगर कुछ बीमारी वारी होके रखा है तो फॉर द बेनिफिट्स ऑफ द रेसिपिएंट, जो उसको यूज कर रहे हैं उसके बेनिफिट के लिए जो सब्सटेंस यूज किया जाता है उसको ड्रग्स कहते हैं, ठीक है। लेकिन जो एडिक्टिव या हैबिचुएटिंग ड्रग्स है वो थोड़ा डेंजरस हो सकते हैं, ठीक है। नॉट ऑलवेज, विल कम अक्रॉस दैट। कुछ लीगल ड्रग्स भी है। सो जो भी है, एडिक्टिव ड्रग्स को बेसिकली आपको दो क्लासेस में क्लासिफाई किया गया है। पहला जो आपको दिख रहा है साइकोट्रॉपिक ड्रग्स, वेरी इंटरेस्टिंग, साइकोट्रॉपिक, एंड दूसरा है आपका साइकेडेलिक। याद रखना, वेरी सिंपल, साइकोट्रॉपिक, साइकेडेलिक। साइकोट्रॉपिक ड्रग्स जो है वो 5 क्लासेस में डिवाइड किया गया है, ठीक है। द 5 क्लासेस इंक्लूड ट्रैंक्विलाइजर्स, sedatives, opiates, stimulants, antidepressants. So you don't have to remember these things with a lot of attention. The word itself will tell you what does it mean. Okay, the first word, tranquilizers. Tranquil means something peaceful. Okay, shanti, ठीक है। sedatives या hypnotics, आप तो hypnotism को पता है आपको। sedative मतलब related to sleep, ओके, जो आपको सुला सकता है। ओपिएट्स या ओपियोइड नार्कोटिक्स, ओके, विल कम अक्रॉस दिस। स्टिमुलेंट्स जो आपको ज्यादा एक्टिव बना सकता है, स्टिमुलेट कर सकता है। एंटी डिप्रेसेंट्स, बहुत सारे people they suffer from depression due to a lot of things, so these antidepressants are consumed to get rebuff the issue of depression, okay। we'll see these things in detail। and दूसरा चीज आपका psychedelic drugs या hallucinogens, they can be natural and synthetic। psychedelic drugs वो होते हैं जो आप यूज करने के बाद कुछ ऐसे अजीब अजीब चीज देखोगे जो कभी होता ही नहीं है, मतलब इमेजिनरी वर्ल्ड में चले जाओगे, जैसे बाबा पीने से या खाने से होता है, ओके, जो मुझे दोस्त लोग या फ्रेंड्स बोलते हैं, ठीक है। एंड यू कैन ऑफन सी दिस थिंग्स हैपनिंग। सो we have few classifications going on around. Number 1, the tranquilizers. Okay, before that, please remember psychotropic drugs are also known as mood altering drugs, ठीक है। ये mood को alter कर सकता है। This can act on brain, it can change the behavior, it can affect the consciousness, किसी चीज को समझने की क्षमता, capacity of perception, that can also change, okay। तो पहला हम लोग स्टडी करते हैं ट्रैंक्विलाइजर्स को। जो ट्रैंक्विलाइजर्स नाम ही समझाता है कि आपके शरीर में वो कंज्यूम करने से पीस आएगा, कामनेस आएगा, शांति आएगा, ठीक है। आपका टेंशन, आपका एंजाइटी को घटा देगा या कमा देगा। लेकिन इंपॉर्टेंट है, विदाउट इंड्यूसिंग स्लीप, ओके, बिना नींद लाए ही आपको शांति पहुंचा सकता है, ठीक है। लेकिन अगर आपको शांति मिले, शायद आप नींद में चले भी जाए, क्या पता। जो भी हो, ट्रैंक्विलाइजर्स को टू क्लासेस में डिवाइड किया गया हुआ है, माइनर ट्रैंक्विलाइजर्स एंड मेजर ट्रैंक्विलाइजर्स, ठीक है। माइनर ट्रैंक्विलाइजर, जैसे आपका एग्जाम है कल और आपका कुछ प्रिपरेशन नहीं हुआ है, बहुत ज्यादा टेंशन में हो, बहुत डर लग रहा है, और you are suffering from some kind of phobia, okay, exam phobia kind of stuff, or anxiety बहुत होके रखा, तब you might be prescribed this kind of tranquilizers. Example, benzodiazepines, B's and D's, okay, or diazepam. Okay, these are very common tranquilizers. Then you also have the major tranquilizers. You have the antipsychotic drugs useful in conditions like schizophrenia, because schizophrenia एक medical condition है जहाँ पे you people, the patients, they suffer from some kind of disturbances, or it's a case where they imagine things which are not actually existing. They find it difficult to adjust, and bhutiya vutiya sapna dekh rahe hai, someone is trying to attack them and all those things. Okay, so this is a case of schizophrenia. Okay, or jab major tranquilizers, example, reserpine. Okay, this is extracted from the roots of a plant called Rauwolfia serpentine. These questions do come in entrance. Please remember that. Okay, so ये जब एडमिनिस्टर किया जाता है किसी पेशेंट को, तब एग्रेसिवनेस, एंजाइटी उसको कमा देता है, घटा देता है, and this kind of drugs help to normalize the thoughts and the behavior. Okay. Then you also have the sedatives and hypnotics. Okay, sedatives and hypnotics, basically they reduce the excitement, they lower the intensity and lower physiological or functional activity with the induction of sleep. Okay, example, barbiturates. Okay, barbiturates are often used as sleeping pills. There are many people who do not get sleep, the condition known as insomnia. Okay, so barbiturates are basically derivatives of barbituric acid, and they're used as sleeping pills, remember that. But there are certain negative aspects to this. If you keep on using this sleeping tablets or sleeping pills continuously for years and years, then this can actually lead to permanent brain damage. Okay, and suddenly अगर आप withdraw कर देते हो, stop कर देते हो, तो epilepsy हो सकता है, जहाँ पे you might have seen people shake and the person falls down. Okay, so there should be cautious and concerned use as far as sleeping pills are concerned. Example, pentobarbital, etc., etc. So you just have to remember which class is used as sleeping pill, barbiturate. Okay, there also you come across the word benzodiazepines. Minor tranquilizer में मिला था और यहाँ पे भी मिला है. This can also be used as muscle relaxant as well as sedative. Okay, so remember that the concentration might vary, the doses might vary. Okay, then comes the antidepressant. Okay, so see, depression is very common these days because of a lot of things. Okay, there could be heartbreaks, there could be ditching of the boyfriend girlfriend issues, a lot of academic pressure, no money, no job. So depression is considered to be mood disorder. Okay, and how it is characterized, it is marked by sadness, hopelessness. You lose interest in various activities. You don't seem to have the energy. You don't get the will to concentrate on the required things, etc., etc. So antidepressants are used to treat such conditions. Okay. Example, very important, remember the name, monoamine oxidase inhibitors. See, remember, monoamine oxidase is an enzyme. Okay, this enzyme is linked to depression. Now, if you can inhibit this enzyme using certain drugs, then maybe depression can be treated. Okay, different kinds of monooxidase inhibitors are there. Example, phenelgin, moclobemide, isocarboxazid, etc., etc. Okay, so you have the different psychotropic drugs associated with different conditions. Then you have the stimulants. Okay, the stimulants are those that stimulate the nervous system. Okay, they make the person more wakeful, alert, active, and cause excitement. Okay, it will make you more active. Okay, almost all of us do consume some kind of stimulants almost every day in different forms. One of the commonest is caffeine. Where do you find caffeine? Tea, coffee, etc., etc. The scientific name of caffeine is 1,3,7-trimethyl-xanthine. Okay, you don't have to remember the chemical formula, but remember the small little structure, and sometimes they might ask you, what is this? The common name. Okay. And in fact, caffeine happens to be the world's most widely consumed psychoactive or legal drug. Okay. Remember, caffeine is some kind of central nervous system stimulant. Okay. And also it is a mild diuretic. In biomedical terms, the word diuretic means those substances which increase your urine output. Means if you consume a lot of tea or a lot of coffee, you happen to go to the toilet quite often. Okay, to pee. Okay. There's another associated or very popular stimulant, that is cocaine. Okay, cocaine is also known as coke or crack, snow, sniff, or big C. C from cocaine, and it is usually snorted the way this person is doing. Okay, this is snorting. Okay, and what is the source? Cocaine is obtained from dried leaves and young twigs or young branches of coca plant. What is the scientific name of coca plant? Erythroxylum coca. Okay, this you have to remember because they often ask, what is the source? Okay, and how does cocaine affect? Okay, cocaine interferes with the transport of dopamine. Okay, I already told you the significance of dopamine. So it is one of the major biochemicals that happens to be one of the targets for different kinds of drugs. And this interferes with the transport of dopamine. Okay, and inhibits the release of histamine. Okay, you will come across histamine in other chapter, but at this moment, just remember it inhibits the release of histamine. Okay. Excessive doses of cocaine causes hallucinations. Okay, even though it is a stimulant, if you consume excess cocaine, then it can cause hallucinations. Okay, you start imagining or seeing things which don't exist. Okay, then there could be synthetic stimulants also. Okay, for example, many of you might have heard about doping in sports. Okay, the sports person, particularly the athletes, they consume certain substances or drugs which help to better their performance. Okay, to increase their speed. Okay, in running or some athletic events. So they're also known as pap pills or anti-sleep drugs or speed uppers. Okay. They're structurally similar to adrenaline. Very important. They're very, very structurally similar to adrenaline. And if there is some doubt that the performance of this athlete is questionable, then they will go for testing synthetic stimulants, which are known as amphetamines in sports person. Okay, what is this effect? The amphetamines actually, when you consume them, it will increase your alertness. The self-confidence will increase. And because of the suppression of hunger, the athlete can continue for a longer duration. Okay. But how do they test it? The interesting fact is that these drugs are metabolized very slowly in the body. Okay. and they can be found in the urine for multiple days. Okay, the prototypes or some of the common examples are benzedrine and methadone. Just remember, benzedrine and methadone are common amphetamines which are used as speed uppers or pap pills and included in dope tests for athletes, and they are found in the urine for multiple days. Okay, then we have the opioid or narcotics or the opiates. As I told, there are multiple receptors in the body. Okay, on the surface of the cell membrane, you have got different kinds of receptors. The body seems to have opioid receptors also. Okay, this is very interesting. Evolutionary, our body has been having the opioid receptors since time immemorial. We don't know. Okay, and what is the original purpose? We don't know. Okay. Nevertheless, there are opioid receptors in different cells in the central nervous system as well as the gastrointestinal tract. Okay, so you have this, for example, is opioid receptors. When the opioid drugs come in, lot of signaling happens inside. Even at the genetic level, changes can happen. Okay, the transcription, the gene transcription may be affected through different signaling processes. Okay, and in fact, this is considered to be the king of narcotics as it contains numerous alkaloids. Okay, if you happen to have overdose of opium, that is the source of opioid drugs, then what is given? Naloxone. So remember, if there's overdose of opium in a patient, then what is prescribed? Naloxone. I am using the word antidote. Antidote is a substance which can act against some toxic component or poison or something. For example, there is a snake bite. So use some substance which can act against the snake bite. That is an antidote. Similar to that, you have the naloxone, which can be an antidote for overdose of opium. Now to talk a little bit about opium, basically opium extracted from the poppy plant, okay, or Papaver somniferum. You have to remember the scientific name, Papaver somniferum. Okay, how is it consumed? It may be chewed, it may be smoked. Okay, what are the effects? In fact, opium has narcotic effects and analgesic effects. Okay, pain killing. In medical context, opium is used at certain concentration in medicinal form. It can act as a sedative. It can act as an astringent. Okay, astringent are those substances that can lead to the contraction of certain body parts. Okay, and overdose of opium can have profound consequences in the body. Okay, for example, it can slow down your respiratory activity. Okay, your eye can, the pupil of the eye can become constricted. Okay, the secretions from your glands can decrease. You may vomit a lot. Your digestion may be disturbed. Okay, and when a person becomes addicted to opium and happens to have it on a regular basis, he or she often loses interest in work and suffer from losing body weight and fertility. Okay? Then we come to morphine. Okay, so morphine is extracted from the latex of poppy plant, Papaver somniferum. Okay, one of the greatest known opioid drugs. Okay, it is medically used as a sedative and painkiller and useful for surgery. So it has got medical application. Okay. You have to remember this chemical structure of morphine because many times it comes. You have to identify this molecule and the plant name. They might ask you to go for match the following. Okay, so remember the structure of morphine and the molecular formula. You may or may not remember the poppy plant's scientific name and its chemical structure of morphine. Very important. Okay. There are other opioids as well, which are very famous. One of them is the brown sugar or the smack. Okay. Brown sugar is diacetyl morphine hydrochloride. So what is there? The two acetyl group. So how can you produce brown sugar? You have to go for the process of diacetylation of the morphine. So two acetyl groups will be added to the morphine molecule. Fine. Now, also, you know that in different places which are serving as dry states where you don't find alcohol or drugs or something, for example, in certain northeast states itself, uh, many times you come across in the news channels that uh, people tend to use cough syrup to get intoxicated. Okay, that is very common. I hope you know that, right? See, in cough syrup, they have a particular derivative of morphine called C3-methoxymorphine. This is known as codeine. So codeine is an ingredient of many cough syrups. This C3-methoxymorphine or codeine is converted to morphine in the body through our metabolic processes. Okay, and uh, the person gets high. Okay, we have the heroin in the list next. Heroin, smack, or as they call it, is a white, odorless, bitter crystalline compound. It is obtained by acetylation of morphine. As I already mentioned here, diacetyl morphine hydrochloride, brown sugar, smack, same thing. The common name or the name that is popular in the drug world, the drug business, heroin. Okay. It is taken by snorting and injection. Either you opt for this or this. Okay. In fact, this smack is 3 times more potent than morphine, and it results in reduced vision, decreased weight, sterility. Okay, your sexual and reproductive health may be affected badly, even epilepsy. Okay, it slows down the various body functions. Please remember this critical aspects. Diacetyl morphine or smack, that is heroin. It is a white, odorless, bitter crystalline compound. Then we come to psychedelic drugs, the hallucinogens, the common BABA stuff. Okay. So what do the psychedelic drugs do? Psychedelic drugs basically produce a dream-like state, okay, with disorientation, and there's loss of contact with the reality. Okay. The user starts to see colors, hear sounds. So these psychedelic drugs are also known as vision-producing drugs. Okay. Common example, natural hallucinogens. Okay, LSD. Okay, lysergic acid diethylamide. Okay. It is obtained from a particular fungus called ergot fungus present on rye plant. Okay, remember, ergot causes diseases in rye plant. Okay, but interestingly, scientists have extracted, or biochemists have extracted this compound from the ergot fungus. And ergot has other medical uses also, particularly they derive certain compounds that are helpful in uh, child delivery. Okay, during childbirth, there are certain compounds which are helpful in easing the muscle contraction relaxation process in the mother's body. Okay, now LSD, what it causes, it can cause interesting horrible dreams. Okay, hallucinations, fetal abnormalities. If a pregnant lady consumes LSDs, that might affect the health and the well-being of the child. Okay. Then we have the cannabinoids, very famous cannabis. Same thing goes with cannabis. You have to remember the structure of the cannabinoid molecule and the cannabis plant. Okay. There are different kinds of products which are derived from the cannabis plant. Cannabis is also known as hemp plant. You have the bhang, ganja, charas, marijuana. Okay. Bhang, the fresh dried leaves and flowering shoots of both male and female plants. Okay. Ganja, the unfertilized female inflorescence. I hope you know what is the word inflorescence implying. Okay. Go back to your class 11, 12 books. Then you have charas, the flowering tops of the female plants, and marijuana, the dried flowering plants. Okay. Then you have atropine. Atropine is obtained from datura seeds. Okay. Remember, there is a particular drug called strontium drug, which is extracted from datura. Okay. You also have other kind of natural hallucinogens like mescaline, which is obtained from a spineless cactus, and it produces low level of hallucination. Okay. Then you have this psilocybin. It is obtained from a mushroom. Okay. Remember that. Then you also have synthetic hallucinogens. Synthetic hallucinogens, for example, PCP. Very simple, PCP, phencyclidine piperidine. Phencyclidine piperidine. What it is used for? Normally, PCP is in veterinary medicine, which is used to immobilize large animals. Okay, if you have a big animal and you want to control it, this PCP is often used. But many people, the addicts, they use it as an angel dust, okay, as a psychedelic drug or hallucinogen. Okay. To talk a little more about the cannabinoids, just like the opioid receptor, we also have the cannabinoid receptors in our brain. Okay. Generally, these cannabinoids are taken by inhalation and oral injection. Okay. I repeat, because this is important, natural cannabinoids are obtained from the inflorescence of the plant Cannabis sativa, that is the hemp plant. The flower tops, leaves, and region are used to produce marijuana, hashish, charas, ganja, etc. What do they affect? They affect cardiovascular system. Cannabinoids are also abused by some sports person. Please remember that. Okay, you have seen amphetamines. Here you see cannabinoids are also used and abused by some sports persons. I hope you can understand the word abuse and use. Okay, there are subtle differences, but very important and critical differences. Talk about drug abuse. Okay, see, different drugs have their own clinical purpose or clinical use, a particular concentration, particular frequency. But when the drugs are used for a purpose other than the clinical use on a regular basis, in an amount or concentration and frequency that will disrupt, okay, or impair, okay, one's physical, psychological, and physiological function, then it becomes drug abuse. So in simpler terms, you have a drug which has a particular medical use. You have to use it at a particular frequency, particular dose, particular concentration. But when a user uses it beyond the recommended level and beyond the purpose which it originally serves, then it becomes a case of drug abuse. Okay. Non-medical use. It is not prescribed by the doctors and the person it using for experiencing pleasure and excitement. Okay. Many times different anabolic steroids are misused by players. Many people these days go for bodybuilding, gymming, and all those stuff. So they want to go for making their muscles within a very short time. They often use anabolic steroids. And there are a lot of cases because of the drug abuse. This really affects their metabolic process and many people die. Okay. So commonly abused drugs include cocaine, heroin, marijuana, different anabolic steroids, amphetamines, etc., etc. Okay, there could be different consequences in both males and females if you use different kinds of anabolic steroids. Okay, to just give you an overview, the males particularly, they can suffer increased aggressiveness. Okay, chal maar dete, kaat dete, that type of attitude. Okay, there could be mood swings also. There could be depression also. So depending on the person, depending on his or her physiological state, so many different effects can be seen. There could be a bad effect on the fertility, on the sexual or the reproductive health. It can lead to decreased sperm production. Kidney and liver may function abnormally. The size of the testicles may be reduced. Breast enlargement may happen in males. Hair may fall before time, premature baldness. Prostate glands may be enlarged. Okay. Talking about the effect in females, more masculinization, more male-like features, increased aggressiveness, mood swings and depressions. The voice may be deepened. The menstrual cycle may be affected. There could be occurrence of excessive hair on face and body in females. The clitoris may be enlarged. Okay, and this can lead to a lot of issues. Okay, so general metabolic activities may be affected. The immunological effects could be there. The reproductive health may be affected badly. Okay. Sometimes what happens in adolescent male and females of your age, many gym trainers, they prescribe, go for anabolic steroids. Okay, this can actually lead to severe facial and body acne. Okay, premature closure of the growth centers of the long bones, resulting in the stunted growth. The height may not increase. Okay, even though the body structure may become gigantic like Hercules, but it is to be taken care of. Okay, so try not to get into anabolic steroid abuse. Okay. Also, I want to stress upon another fact. Many of you might go for exercise. Okay, exercising is really good. Really helps, particularly in this current COVID pandemic fiasco. Exercising is really a requirement to keep your body system fit. Training is good, but overstraining is bad. Okay, do not over exercise. That is important. Please remember that. Next, we come to smoking. Since history, long years back, tobacco has been a part and parcel of mankind, but it's not that we talk about nicotine. There was different traditions, even it happened to be a part of religious rituals. Okay, and there are incense sticks that were burned. Okay, tobacco has been used by human beings over 400 years, as they say. It is smoked, it can be chewed or used as a snuff. Even I have come across some people, what they do, they will put the tobacco leaves in water overnight and drink the water in the morning. Okay, that's quite surprising, and that was really quite a bit of astonishment for me. Nevertheless, tobacco contains different chemical substances, thousands of chemicals. One of them is nicotine, which is an alkaloid. It stimulates the adrenal gland to release adrenaline and noradrenaline. Okay, it can cause high blood pressure and heart rate. Okay, remember that. They often say smoking causes cancers of lung, urinary bladder, throat, bronchitis, coronary heart disease, gastritic ulcer, etc., etc. Okay. I hope you know the genetics of cancer. If not, we'll surely study that. everyone who is not even a smoker is predisposed. We can suffer from cancer. Okay, it has a close association with the genetic makeup. Okay, there are certain genes, oncogenes, proto-oncogenes. Okay, nevertheless, oral cancer is very common, and on the packets of cigarettes, it is mandatory to show the plausible health effect. I don't know if someone of you smoke, then you might have seen the packets. Smoking increases carbon monoxide content in the blood, okay, and it reduces oxyhemoglobin. Okay, remember, hemoglobin's main function is to carry oxygen, carbon dioxide, right? Now, if there is huge amount of carbon monoxide in the blood, then this CO will bind to hemoglobin, and as a result, the oxyhemoglobin is reduced in the body. So this leads to deficiency of oxygen in the body. Okay, so सांस लेने में problem. Okay, this is one of the major outcomes. You can see some of the pictures: smoker's lung and healthy lung, normal alveoli, okay, the air sacs, and alveoli with emphysema. You can see the alveoli are damaged here. So smoking can have a lot of health issues. Just a small repetition of whatever I said with some additional information. Tobacco or tambaku, the main source, Nicotiana tabacum and Nicotiana rustica. Okay, this is one of the commonest plant species. Okay, they can be used as biri, cigars, cigarettes, gutka, hookah, pipe smoking, snuff, tobacco paste, and tobacco water, as I mentioned. Okay, this is important. Nicotine, the main toxic particulate constituent, ganglionic stimulant and depressant, co-carcinogenic. Carcinogenic means something that can cause cancer. It can cause addiction also. Important, cotinine is the main alkaloid of tobacco and metabolite of nicotine. When nicotine goes in, metabolized into the component called cotinine. Okay, this is dangerous. Then there could be tars, which can act as carcinogenic. There could be aromatic hydrocarbons, which can be carcinogenic. There could be phenol, prazole, these are all carcinogenic. There could be some compounds like beta naphthalamine and nitrosono-nicotine, which are also carcinogenic. Then there are toxic gaseous constituents like carbon monoxide, which I already mentioned. It can disrupt the functioning of hemoglobin. You have certain compounds like nitrosamines, hydrazine, vinyl chloride. You have HCl, acrolein, nitrogen oxide, acetaldehyde, etc. They can act as irritants. Okay, and ciliotoxins also. Effect of drug and alcohol abuse: reckless behavior, vandalism and violence. Vandalism means you are destroying public property. For example, you might have seen दारू वारू पी के उन लोग पूरा होटल वोटल तोड़ देते हैं. That is vandalism. Now, public property को कोई भी, लेकिन at the same time vandalism is a public offense. Okay, बस में अगर हम लोग अपना नाम लिखते हैं या कोई पब्लिक प्रॉपर्टी जैसे ताजमहल चले जाओ या कामाख्या मंदिर हो गया, वहां पे the words R+X, R+Y ऐसे लिखते हैं. So that is also an act of vandalism. It is not okay to do these things. Okay. Then drug and alcohol abuse, obviously they can lead to even death due to respiratory failure, heart failure हो सकता है, blood clotting हो सकता है, cerebral hemorrhage हो सकता है. Many times people tend to use drugs mixed with alcohol, and that can really cause death. Nervous system may be damaged, liver cirrhosis may occur. Obviously, drug and alcohol abuse can cause mental and social distress to the family and friends. And because of sharing of needles and other stuff, it can actually contribute to spreading of different maladies like AIDS, acquired immunodeficiency syndrome, hepatitis B, etc. Okay. Another important thing, if drug and alcohol abuse is seen in or practiced by pregnant ladies, this can really affect the fetus, the growing baby inside the mother's body. Okay, FAS or fetal alcohol syndrome, okay, where the physical and the mental damage occurs in the child due to the alcohol exposure while in the womb. Okay, so the child may not have a good physique or the mental status may be low. Okay, there could be loss of sexual drive and necrospermia. Okay, try to find out what is the meaning of necrospermia. Okay, many times, as I already mentioned, the drugs may be misused by athletes, different drugs, and this is not a good thing, obviously. What are the warning signs of drug or alcohol abuse in adolescence period, particularly this age? Okay, the user may not be able to cope up with the academic demands or the requirements. So he or she may lose interest in performing well. There could be absence from the school, lack of interest in personal hygiene. Okay, he or she may live in a very dirty condition. He or she doesn't care about what is cleanliness. Okay, if he or she may love to live in isolation. Okay, he or she may withdraw from the society. Okay, depression, fatigue, easily he or she gets tired. Sometimes even they can show rebellious behavior, okay, fighting attitude and all those stuff. The eating habits may be changed, the sleeping habits may be changed. The weight may sometimes increase, sometimes decrease. There are fluctuations. To do something, to get involved in some good activities or hobbies, the person tends to lose interest. The relationship with friends and family, it gets deteriorated. What are the effects of alcohol addiction on the health? Multiple effects. You might have seen a lot of movies which actually portray the effect of alcohol consumption. It can lead to doom. Okay, even though it can, many people tend to drink and tend to think that they're finding solace or happiness. This is all temporary. Okay, alcoholic fatty liver, alcoholic hepatitis, alcoholic cirrhosis, cholestasis, etc. are very common. But these other factors from the medical perspective are important. Gastritis is common, and many people, after consuming truckloads of alcohol, they happen to vomit, okay, due to heavy drinking. This is known as Mallory-Weiss syndrome. Okay, this is very common, and many people show this. Okay. Another important thing what I have noted, particularly the Asian people, after drinking, they tend to show a deep red coloration, okay, on the skin. They tend to sweat or something like that. That is known as Asian flush. Okay. Another interesting fact about the effect of alcohol addiction on our red blood cells. Okay. The size of the red blood cell increases, but the number of red blood cells decrease. Remember that. The WBCs as well as the thrombocytes or the platelets decrease. Okay. Platelets, I hope you know, they are also known as thrombocytes. They help in blood clotting. Okay. WBCs, white blood cells, they're involved in fighting against diseases. Red blood cells, because of the presence of hemoglobin, they are involved in carrying oxygen, carbon dioxide. Okay. So the number of RBCs, WBCs, and the platelets decrease, although the size of the RBC may increase. Okay. I don't know if anyone of you, I hope not, have drunk beer or something. Rapid dehydration happens, okay, because of the action of a particular hormone. Okay. Previously, I mentioned the word diuretic. Diuretic is something which actually increases the urine output. Okay. In the body, we have a hormone called ADH or antidiuretic hormone that will lead to decrease in the urine output. Now, if this hormone's amount is reduced, then what will happen? Lot of urine, lot of urine, lot of urine. Okay. As a result, rapid dehydration might occur because of over consumption of alcohol. Okay. Then if there is excess consumption of alcohol, that can also lead to decrease in resistance to infection. Okay. Reduces blood sugar level. This is quite a debatable thing because diabetes is a very complicated disease. Okay, this still needs some kind of research. Okay. Many times it dulls the senses and acts as a depression of various body functions. Okay. Another important thing you might have often heard or noticed, it is said, do not drink and drive. Okay. Why? What basically happens when you are high or when you have drunk a lot, your reaction time increases. Now, what is reaction time? Suppose you are driving and a truck is coming towards you. Okay. When you are not drunk, you will obviously uh, drive your car to a safer side and the truck will pass. Okay, because you have responded within a short time that a truck is coming and it might hit you. So you are cautious, you are alarmed. But when you're drunk, the time taken to judge the right and the wrong, what could be the consequence, that increases. So you are unable to make the decision or react at the right time. So the truck might come and hit you and it might lead to an accident. So it is often prescribed that you should not drink and drive. Okay. How to control and prevent? Avoid undue peer pressure means friends. That is very critical. Education and counseling. There are special counselors. You should be educated. Now you know the things you should spread. You should take help from parents, and friends can also be critical here. Okay, so you are the person who has to judge whom to trust, whom not to. Okay, you should always be cautious and alert and check for the danger signs. If required, professional help must be sought after. Okay, psychologists or psychiatrists should be consulted. Okay, and also throughout the globe, throughout the planet, there are different de-addiction and rehabilitation programs. Okay. So de-addiction basically means treatment of addiction of any addictive substance. Okay. You should not make a person stop consuming a drug or an addictive substance suddenly, because his or her body might show withdrawal symptoms and that can be dangerous. Okay. So always proper care and management should be taken into consideration, and it's a slow process, a methodological process. The treatment of addicted people is a slow process. Okay. What basically happens when an addict is denied the drug and the drug is suddenly stopped, the level of cyclic AMP in the brain shoots up. Okay. Vitamin C, it can be present in lemon, karela, etc., bitter gourd, can take care of sudden rise in its level. Okay. Cyclic AMP has a lot of effect on the signaling process in the body. Okay. Also remember, there is something called Alcohol Anonymous, or AA. It is an international organization which was established in 1935. It provides good support and counseling to alcoholism. When you are going for drug de-addiction or alcohol de-addiction, make sure you take active support from your friends and family members. You might be knowing people around you who are addicts. Okay. There are different natural therapies and good lifestyle practices. Okay. Also, many times some aversion drugs like disulfiram are clinically prescribed during this drug or alcohol de-addiction programs. Last part of this chapter, let us talk about teratogens. This is very important and very interesting, but very sad at the same time. What happens, there are certain substances, if consumed by pregnant ladies on an abnormal scale, this can actually lead to abnormality in the fetus, in the babies. Okay. So one of the most common and most infamous, not famous, most infamous synthetic teratogen was thalidomide. Okay. I'll come to that. Thalidomide, actually, it is a drug that was developed in the 1950s by a West German pharmaceutical company called KRISHNA Grunenthal GmbH. Whenever you come across GmbH, that means German. Okay. See, the purpose was as a sedative or a tranquilizer for the pregnant, for different ladies. Okay. But it was used for treating a wide range of other conditions like colds, flu, nausea, and morning sickness in pregnant women. Okay. Teratogens can lead to a lot of bad consequences. The pregnancy may fail. Okay. When the baby is inside the womb, the hands, the limbs, the legs may not develop properly. The organs may not form properly. Okay. So there are developmental and functional abnormalities of the baby. Okay. Different kinds of teratogens are there. Already we have come across different kinds of drugs. They can act as teratogens. Apart from thalidomide, whatever I have mentioned just now, this LSD, morphine, warfarin, tetracycline, silbesterol, all can cause different kinds of effect. For example, it can affect the bone development. It can lead to less supply of oxygen. The chromosomes may be fragmented in the baby. The nose, eye, and hand may be defected. The growth may be retarded, etc., etc. To just give you a visual picture, see these. Okay. This is a condition known as phocomelia. Now, what is that? The babies have limbs or hands just like a seal. Okay, seal-like limbs because of teratogens. Okay, so you can see the effect of teratogens. Some drug which was originally used for some medical purpose, but because the pregnant woman had consumed it, it led to this condition. Okay, so with this, we come to an end of this chapter, or rather this portion of this big chapter, human diseases. We'll meet again, hopefully. Till then, stay safe and keep rocking. All the best.